PULP Colorado. We had originally wanted to bring you a new season of PULP called Talking Points. That was to explore the major questions of Southern Colorado life and to evolve what local media can do. Instead, COVID-19 happened. So while the media industry and entire parts of the economy are experiencing technical difficulties, journalism and reporting has not taken a break. If we could guide you every evening through this crisis with local context and coverage beyond just headlines, we would. We'll try our best to do what we can with what we have, but how we do this is going to be rough for a little bit. If you like what we're going to share, then share what we're going to do. But this isn't a show or one video. Think of it as telling the story however is best and whatever channel is best. Sometimes it's videos, sometimes it's articles, and other times it's just an Instagram post. It's not always going to be COVID-19, but much of it will be. Our goal at PULP is to tell a better story of Southern Colorado, so here we are. We are going to do this our way, however. We're going to do news and culture, interviews with leaders, the local community, artists, creators, and beyond. Whatever journalism was, it is not that anymore. So tonight we're going to feature an interview with Randy Evetts, Director of Public Health for Pueblo, and we'll talk if Pueblo County is ready as the peak of COVID-19 is expected to arrive over the coming weeks. We asked him to give you a broad view of how the county is preparing and what you can expect. He will decide in the next coming days. It's a fluid situation, but if Pueblo County will extend the stay-at-home order, or if more stringent requirements will be put on Pueblo County as the peak of COVID-19 starts to hit this area. Director of Pueblo Public Health, first off, I think because we'll ask everybody this question, how are you guys doing over there in terms of spirits and morale? So I'll just start off with that.
You know, I'm really proud of our team. People have really rallied with this. These kind of events often bring out the best in people, and we've certainly seen that in acts of leadership and kindness and teamwork. And I'm really proud. I think everybody's doing well. We are working closely both at the health department and at the EOC to make sure that people are getting breaks and taking some time. And so we're working through a plan so that people are not burning out, or at least have a little time to recover and not think about COVID-19.
Right. Let's just take the large picture of the county, and what is it that you as the health director is looking at over these next coming weeks? What are you anticipating, and what can the public expect to see from you?
Well, I think that like the rest of the nation and the state, we are expecting to see a surge. We don't know what that surge will look like, and we're hoping that the social distancing measures will spread that out and minimize that surge, but we are expecting to see a surge. Certainly in the last few days, we've seen an increased number of positives coming back. And for every positive that we receive, we expect that there are many that aren't testing, but who are symptomatic and maybe even have COVID that we don't know about. So we're expecting it to be more widely present in our community. We don't know exactly what that number looks like or how that will play out, but we expect our trend to follow closely with what's happening at the state and the national level.
And the governor said yesterday that there's between 13,000 and 30,000 unknowns in the state. Does that give you pause about what state numbers are looking at in terms of these unknown numbers?
Certainly, it's scary to us in some ways to think about what we don't know. But I think that, you know, we're approaching it from a standpoint that we're doing as much as we can to prevent and to get the messaging out for the distancing and to promote that and to support that work, knowing full well that it is in our community and that we're doing the best we can to respond. I think that there's some promising things coming out in terms of testing and some new opportunities for testing, but those have not reached our community yet. Those are just starting to roll out this week from CDC and some others approved testing. So, you know, I think the longer we can delay this from impacting our community, the more opportunity we have to have some of those other resources available to us from testing and maybe even treatments that they're looking at to support and help our community.
And that ties into what the governor said early on Monday, that this is really to delay to give you time. So on that end, can you talk a little bit about the local hospitals and how they're ramping up and how they're preparing for the surge? Because the entire nation really is trying to be ready for this bed supply and PPE problem that seems to be happening. So could you give us a status on what you're hearing from the hospitals?
Absolutely. We are meeting with the hospitals on a weekly basis, and they are doing some incredible work to prepare for this. Currently, both hospitals are reporting that their volumes, their normal volumes, are below what they would see on an average, which is good. That means that, because people aren't getting elective procedures and are not going into the hospital for elective types of um, uh, procedures, they are able to keep that bed count low. The hospitals are seeing an increased number of folks coming in, but they're managing that well. Both hospitals have taken inventory of their respirators and anesthesia machines. Anesthesia machines can be converted to respirators, so that increases their capacity a bit. We believe that there's about 80 to 90 respirators available in our community at this point, and there's others on order, and we're trying at the EOC to find some of those and those kind of things. Some of the hospitals, or at Parkview specifically, I know that they've converted even more of their rooms to negative pressure so that they're available and ready. The hospitals are both working to have separate units and separate staff who are managing COVID patients to keep and prevent cross-contamination into med-surg units and other units. So our hospitals are doing a lot, and I do believe that they're ready for that. On a state level, then, we're also hearing and knowing that the state is working on these alternative care facilities as well around the state. I think Pueblo is on the list, and they're looking at Pueblo for those things, and those would be step-down units to help keep the most serious patients at the hospital level for the highest acuity, and then those patients who can be stepped down and still need hospital care but don't need to be in a high acuity facility can be taken care of. So there's a lot of activity going on with the hospitals, both locally and at the state level.
Just briefly talk about, if you can, what the nurses and the frontline and the doctors are experiencing right now. If you're weekly, because we don't get a sense in the hospitals of kind of they're doing their job. So if you could give the public, just a little bit of an update on morale and what they're feeling over there as a body, because they are going to be the front lines of this.
Sure, I haven't been there myself personally, so I'm relying on anecdote as well. I believe that it's an incredible group of dedicated people who are working so diligently and feverishly to try to support the patients and take care of patients. I think that there's certainly some concern about the availability of personal protective equipment, and that's a state and national issue, not just a local issue. I think that those folks are tired. They're working long shifts, but they're troopers, and they're really giving their heart and soul to try to make this better for our community.
One of the things that you just mentioned and the Pueblo County is looking at is sort of an influx from some of our rural regional counties.
Sure.
There's been, I know there's rural hospitals with the numbers increasing. Baca is now up to 9. Los Animas County is seeing some more numbers. Huerfano County is seeing some numbers. Can you give us what is it that's going to happen if these rural counties see a surge or there's an outbreak in a facility? How prepared should Pueblo be, or will those people just be? Is the state setting up a system just to get them into a hospital or facility that has capacity?
Sure. I think that Pueblo and Colorado Springs and Denver are already regional hubs for those hospitals and those communities. And in Southern Colorado, certainly Pueblo is the first site that and actually from the San Luis Valley, a lot of the patients come to Pueblo. So it's not an unusual thing, and our hospitals have been built around that for capacity in the past. So I also think that those rural hospitals may play a role in supporting some of those patients who are less acute. It means that the state is going to have to move patients around, but the state is working with these alternative care facilities and other ideas about how they will have transport teams to move patients around. So it may shift population or patients to us, but we may also be able to send less acute patients and patients who are not COVID positive to some of those facilities for recovery as well.
Back in Pueblo County, what is it that you are preparing for and is of the greatest need? Obviously, the governor said that they need, and you said, a lot of masks, PPE, stuff like that. But in terms of the illness and the virus, what is it that your plan and Pueblo County Health is from now until, say, April 30th or beyond into May? What is it that the public needs to know that you were setting in motion to address this?
Well, certainly we're continuing to look and watch the social distancing and the state orders. Those currently only go through April 11th, but we are planning and expecting that those could be extended either at a local level or at a state level, though there's no indication from the state at this point that that could happen. But given that that we might be a few days, our curve in Pueblo may be a few days to a week behind what's going on in Denver, we would expect that we might hit our peak specifically in Pueblo a little later than those communities, and therefore may have to extend out some of those things. It's really day by day, John. We're trying to monitor the data, see what's happening nationally and locally. As you've seen from the state level and the national level, things are changing on a day-to-day basis. So we plan the best that we can, and we try to predict, but every day seems to throw us a new curveball, so to speak. So we have to be flexible and able to adapt to those. I think that we are certainly expecting, as I said earlier, that we will have an increased number, and we're seeing that already, an increased number of patients who are positive. I think we will continue to see hospitalizations. We will continue to see, unfortunately, some deaths, which is very tragic for our community. One death is too many. But I think that those are things that we're expecting and we're talking to our partners about. Today, we had a meeting with long-term care partners to say, how can we help you to be comfortable taking those patients from hospitals that need to step down, but that are no longer need that acute care, but we understand and know that those long-term care facilities also have some concerns, and they're lacking the PPE and some of those things. So we're trying to work through some of those things just to prepare for the surge that can happen. We don't know when it's going to happen exactly, and we don't know to what extent because of the social distancing measures that we've put in place, but we're trying to plan for all of those potential outcomes.
Again, on the social distancing, do you believe that that's had an impact to sort of bend or push the curve a little bit to give you time? Are you seeing those things happening in Pueblo County?
Anecdotally, we certainly believe that it's happening, and like the state, those measures have not been in place long enough for us to truly see the impact. We expect that to be about a 2-week delay before we can see those. So those actions that we put into effect last week and early this week, we won't see how that impacts the curve for several weeks. So there's a lag time behind that. So I believe that it will have an impact on slowing that, and certainly nationally we do, but to actually give you data to say that it's working, we don't know that yet.
Finally, if there's something that you could say to the community to, put Pueblo County and the region in the best possible position to handle this, what would you express back to the community that we can do stuck in our homes, kind of unknown, the unknown is what to do? What would you tell the people of Pueblo County to do to lessen this impact?
I think it's important that we're all patient with it. I am just like everybody else. I want to be out. I want to be doing those things, those social activities and those things. But if we can maintain this social distancing and we can reduce the amount of folks who are going to the grocery store and going to the Walmarts and going to the different kind of locations, it's not that they shouldn't go there, but they should go there as minimal as possible. We can make a difference in this, and we can save lives in our community. So I hope that everyone will take it serious and continue to take it seriously. People need to take care of themselves at home, take care of their own mental health. We encourage people to get out and take a walk, but do that with social distancing in mind, do those kind of things, get out and exercise, get some fresh air, but stay at home, stay in your neighborhood, stay, avoid the parties, avoid the gatherings, even though that's a temptation, and really just wait it out with us a little bit. I think that will have a tremendous impact, both on the health of the community as well as the economic health in the future, because if we do it right now and we do it well, there's a chance that we can start and get back on track with our local economy sooner.
Is there, one last question, is there any plan that, I know you said things are fluid, but to put more stringent social distancing measures in place, or extending extending this sort of stay-at-home measures that you have, or is that fluid right now that you're just looking at day to day?
There's no specific plan currently, but it's certainly something that we're always considering and looking at the different dynamics that are happening. You may have seen that we put out a press release earlier in the week that I'm strongly encouraging churches at Easter to do some alternative things. I know that faith is important. It's important to me in my life, and it's important to many people in their lives. But we're encouraging those things to continue, but just in a different format. Use an online format, broadcast it differently. Use the other technology that we have to make that available to people without bringing them together. So we are continuing to look and think about those distancing guidelines. There's a lot of things to consider, and I certainly wouldn't make that decision without consultation with our local leaders and health officials to determine if it really is scientifically reasonable to extend those guidelines.
Well, I guess just like the governor said, that's a fluid situation, and you'll look at that day to day. So I appreciate you joining us today, and I appreciate your time. So thank you for being here.
Thank you, John.
Thank you.